to our video training guide for the J-tip needle-free injector. In this video, we will demonstrate the 4-step process of using the J-tip as well as the best practices that should be observed. Let's begin by learning about the J-tip and how it works. The J-tip is a needle-free, sterile, single-use jet injector that delivers lidocaine subcutaneously using compressed CO2 gas. The CO2 gas creates a fine stream of liquid anesthesia that exits the device through a small orifice and passes through the skin. This creates a spray-like pattern of medication once inside the subcutaneous tissue, allowing for broad dispersion and quick absorption. Jet injecting lidocaine with the J-tip is a fast and effective way to reduce pain and help make patients more comfortable during common needle procedures like IV starts and blood draws. The J-tip is FDA cleared for use with lidocaine. Many facilities use 1% buffered lidocaine to minimize any sting or burn that can be associated with standard lidocaine. However, if buffered lidocaine is not available, 1% preservative-free lidocaine can also be used. Filling the J-tip can be done either by the appropriate clinical staff, your hospital's pharmacy, or a third-party compounding pharmacy. Pre-filled J-tips from a pharmacy will be ready to use as needed. If the appropriate clinical staff will be filling the J-tip, they will need a standard Luer-Lock syringe to transfer medication into the device. Some hospitals may provide pre-filled Luer-Lock syringes, however, medication can also be drawn from a vial. Prior to filling the J-tip, make sure to tap out any air bubbles from the Luer-Lock syringe. To fill the J-tip, attach the filled Luer syringe to the J-tip. Make sure the connection is snug and then transfer medication into the device. Be careful not to overfill, as medication cannot be withdrawn once inside the J-tip. Select a subcutaneous injection site near where your patient will be receiving an IV or other routine needle procedure. Disinfect the area and allow it to air dry. If your injection site is near a vein, you can inject to the side of the vein, or you can use the Z-track method. To use the Z-track method, remove the orange Luer cap and make a bullseye impression with the end of the J-tip over the site where you plan to start the IV. Using your less dominant hand, pull the skin away from the vein during the injection and then release the skin once the injection has been given. If your patient's vein rolls with the skin when you attempt to Z-track, release the skin and inject to the side of the vein instead. Never inject directly over a vein. Before using the J-tip, check and confirm the medication dosage and expiration date. To prepare the J-tip, remove the orange Luer cap, then gently lift up on the white activation lever and slide the orange safety collar forward. Note that a pre-filled J-tip will have an orange sterility cap in place of the orange Luer adapter. Once you are ready to give the injection, hold the J-tip at a 90-degree angle as shown. Hold the J-tip against the skin with enough compression to create a small dimple. Remember to face the exit port away from yourself and your patient, as this is where the compressed CO2 is exhausted. Squeeze the activation lever inward until you hear a pop sound and continue holding down for an additional 2 to 3 seconds. The sound the J-tip makes is the CO2 gas being exhausted from the device. We recommend letting the patient know about the sound ahead of time or use age-appropriate distraction methods. After injection, it is common to see a small skin wheal and pinpoint blood reflux at the injection site. Massage the area with sterile gauze after the injection, as this helps to further disperse the medication. You can expect about a dime-sized area of coverage that should go numb within 1 to 2 minutes and last for approximately 15 to 20 minutes thereafter. Here are some common mistakes and best practices while using the J-tip. Common mistake number 1: not holding the J-tip down for an additional 2 to 3 seconds after activating. This is a common mistake. Lifting J-tip too quickly after activation can result in medication spraying out on the surface of the skin. Common mistake number 2: applying too little or too much pressure to the skin when giving the injection. You need to get a direct seal on all sides of the J-tip, so be sure to have a small dimple in the skin when you inject. If there is too much or too little pressure, the medication can spray onto the surface of the skin and will not be absorbed. Common mistake number 3, accidentally injecting directly over a vein. This can happen if you inject too close to a vein or if you use the Z-track method when the patient's vein rolls with the skin. Only use the Z-track method if the vein stays stationary, or plan to inject to the side of the vein instead. Best practice number 1, using sterile gauze to massage the injection site afterwards. Using gauze helps further distribute the medication after injection, which can help increase your numbing area. The gauze is especially important if injecting next to the vein, as the medication needs to be manipulated over to the desired needle insertion site. Best practice number 2, explaining the sound the J-tip makes to the patient beforehand. To avoid a patient being surprised by the sound of the J-tip, it is important to let the patient know ahead of time, or to use age-appropriate distraction methods. Our app plays a video clip of the J-tip sound, and many caregivers like to use games, songs, or books to help distract the patient during the procedure. It is often compared to the sound of opening a soda can or a rocket ship going 3, 2, 1, blast off. Please visit our website or contact us for more tips based on certain age and anxiety levels. Best practice number 3, getting enough hands-on practice. Practice is essential to seeing success. Get used to the sound, how to squeeze the trigger, and proper positioning on the patient. Utilize super users, child life specialists, and reach out to staff who feel comfortable with J-tip for assistance and support. Using the J-tip on school-age patients or older for your first time can help give better feedback as you are getting more comfortable. They also tend to be less fidgety and anxious than toddler-aged patients. If your patient is unable to sit still or is severely anxious, other pain management options may be used. Following these steps and best practices, in addition to reviewing the J-tip user guide and IFU document, will help you see the most success while using the J-tip. However, if you are having trouble getting the expected results, please reach out to one of our representatives for assistance. These documents and many other resources can be found on our website at www.jtip.com under the Resources tab. Thank you for learning about the J-tip needle-free injector. We hope this video training guide will help you feel confident while using the J-tip, and most importantly, help to improve your patient's experience. Thank you for watching.